Well, we're into that period known as open enrollment. If you want coverage for next year, you've got to sign up before the end of January.
Yeah, a trip to the health insurance marketplace will yield countless options, but there's really only one plan created by our local physicians.
Yes, that is right. And from Mippa, Dr. David Allen and Dr. Robert Falk. Good to see you guys this morning.
Welcome back.
Yeah, we were on
Thank
last week,
you.
talked about this plan, and it seems like more and more people are finding out about it. But break this down for us again. What is Mippa and how did it come to be?
Mippa is a group of about 800 physicians locally and really now expanding throughout the state. This is our third year now going on the exchange, and we've got people all the way in western Iowa to western Nebraska.
About 800.
800 primary care and specialists.
It's just remarkable. And as we talk about the Mippa healthcare plan, describe it. I mean, I know it's kind of complicated to get into it here and just ask you to do it in a minute, but if you could boil it down.
Well, let me give you a very brief thumbnail, and a lot of your viewers, I think, probably are familiar with it anyway, because a lot of people now are a little bit used to going onto healthcare.gov and shopping. So, first of all, the Mippa product is a high-performance network, which just basically means that it's a group of physicians and hospitals working together. Number two, it's a point-of-service plan, which means that the consumers can pick their level of service. So if you've shopped around, you're familiar, you can get a bronze plan, a silver plan, or a gold plan, depending on what your needs and your tastes are. And then thirdly, the Mippa product is a PPO plan, which basically means that there's preferred providers, and if you're in network, you get a little bit better pricing and insurance reimbursement versus going out of the network. So that in a thumbnail sketch is what the Mippa health insurance product is, which was designed by the Mippa leadership and physicians.
Yeah, and you put that plan together with all those advantages, but I guess in the first place, when the marketplace came out, why did you decide to put together a health insurance product?
Right. So what Dr. Fox said is all-inclusive, but what we found out when we started looking at the options was that as physicians, independent physicians, we could design something that would be much more cost-effective than what's out there. So when you go and look at the exchange, you should see that ours is going to be the least expensive, and if it's not, it's within a few dollars. But even more importantly, when you get into it, and you start having issues throughout the year and you need studies done, you talk with your physician, as independent doctors, we have all of the opportunities, since we're not employed by CHI or the university or Methodist, we can send the patient wherever is the most cost-effective testing. So if you have an outpatient test, a lot of people don't realize it's a third of the price as an inpatient test.
Right.
So we really help save our patients money by putting them in the right place, and I think that shows now. Our premiums are lower because we're really saving a lot of people money.
The doctors keep that in mind at the time of care.
Exactly.
Is what you're talking about.
Exactly.
Yeah.
And do you think that's because you're more closely connected to the patient instead of being sort of a suit in an office several states away and you don't know that person's name, you don't know their story.
Right. Absolutely.
But the two of you do, because you're interacting.
Absolutely. I think that's one of the big advantages we have as Mippa and a physician-directed organization, is that as independent physicians, we're actually doing the same thing that our patients are. I go on healthcare.gov and Midwest IPPA, and I'm shopping for my healthcare for my family, just like my patients are. So we get it as independent physicians what the patients are going through. We also understand the troubles of dealing with insurance companies, getting benefits, getting coverage, and so forth, because we live it. That's different than if you're an employed physician and you're getting your insurance through a large organization where you never really have to shop for it. You don't really understand maybe as well what all the problems are and issues that your patients face on a day-to-day basis getting health care. So I think that gives us an advantage in that regard, which we've tried to put into our healthcare product.
And that's why you've grown 6 times.
10 times.
Yeah, at least.
Well, since the beginning. I'm thinking about the last year alone.
600 people to 6,000 this
where we
last
are
year.
now. But it's because I feel like in our neck of the woods, people are anxious to share when they've had a good experience with something, when they saved money.
Right.
They want their neighbors, they want their families to know about it, and that word of mouth is part of the reason why you're growing as quickly as you are.
And I think it's a good point now, a good time now to talk about how people get registered for the plan. Break down what the health insurance, what the exchange is, and how they get registered for your plan.
Yeah, go ahead.
Sure. Well, there's a number of ways to do it, but basically the two common ways to access these plans would be A, to go onto healthcare.gov, which should list all plans by all different insurance companies that are licensed to do business in Nebraska. The other way to specifically access our plans and other plans through Coventry Health Insurance, which is where ours is you can go to midwestippa.com. And from there, you can directly access the plans under Coventry, which also list the Midwest IPPA plans there. And as I mentioned, there's various plans we have in that you can pick your level of service.
And some people would rather call instead of logging on to talk about some of those options, and we've got a number for you there as well. But you've got to know. No matter how you go about this, you have to sign up by January 31st, and I know that's not your decision. That's sort of the rules of the road. But of course, if you want coverage for January, you want to sign up before the start of the year. The number to call is toll-free, 877-907-4044. And if you'd like to learn more online, again, as Dr. Falk said, it's midwestippa.com.
Yeah, this plan, it just makes sense to me. You know,
Yeah.
a plan brought to you by doctors for their patients. It just seems to make sense.
Yeah.
think so.
Yeah.
Thank you for coming in today.
Thanks for
It's
having
great
us.
to see
Thanks,
you
guys. Yeah,
both.
good to see
for
you.
having us.
I guess